Hello Africa, it's a pleasure to have you all once again on Ladyz Digest, where issues in the world of women are discussed. Ladyz Digest is proudly brought to you by AAU TV, the voice of higher education in Africa. In today's episode, we'll be discussing depression in the 21st century woman. And depression it's a common illness or common serious medical illness that affects the way you act, the way you think, the way you do things. Do you want to know more about this topic? Stay tuned, and after the introduction, we'll get to know our guest who would give us details into this discussion. Remember, you can join us on our social media handles on Facebook and YouTube at the Association of African Universities, and you can follow us on Instagram at Ladyz Digest. I'm Joni Kuyayua. Do stay tuned. Our guest for today is Joan Uche Emeyazia, a Nigerian based in the Republic of Ireland. She is a supply chain analyst, but her passion is to see people live a healthy, fulfilled life, which is why she is a counselor in VIEW, soon to be certified. She is also very passionate about mental health advocacy, emotional well-being, and self-development. And her hobbies are reading, traveling, and listening to music. Okay, welcome back from the break. As I said in my introduction, we're discussing depression in women, depression in the 21st century woman. And I have a very special guest. I gave a hint early on, but I have a special guest and an expert who would help digest and do justice to the topic for today. And she's no other person than my namesake, Joan. She's Joan Emeyazia. I hope I pronounced that well, Joan. I hope I've not dealt with your name. Welcome, Joan.
Thank you very much. Nice having me here.
Okay, how are you doing?
I'm good. How are you? And how is, I guess, in Ghana?
Yes, I'm in Accra, Ghana. And how is the Republic of Ireland today?
Well, it's fine. Rainy day. It's been raining since morning.
Wow, I see. And the pandemic, how has it treated you? How are you coping with the lockdown and the post-lockdown? And are you working from home now? How has it affected your work?
Most times we work from home. So right now I work from home. So although the lockdown has been lifted, kids have gone back to school and all that, but there's no cure yet. So everybody is still trying to be careful and all that. But hopefully all this is going to be over really soon.
Sure. We can't be too careful. We all just need to be careful to reduce the spread. Yeah, so today we are looking at depression in the 21st century woman. And I chose the 21st century woman because that is where we all belong to right now, that age group. So I would want to get a very general definition of depression before we try to just streamline it to women. What would be your definition for a very lay person who comes to you and wants to just know a very lay definition of depression? How would you explain the term definition to the person to really get the person understand what you mean?
Okay, thank you very much. Depression is a mood disorder. It's if it's diagnosed clinical depression or major depression, is a mood disorder. It affects your feelings, the way you think, the way you react. It affects your mood. It causes lack of interest in the things you used to love before. All of a sudden, you no longer feel sad. Long term, you feel sad, you lost interest in the things you used to do, in the things you love doing, you're withdrawn from social activities, you're withdrawn from family and friends, you're withdrawn from, relationships and all that. Those are symptoms of depression. So it basically it has to do with your mood. Your mood, you're feeling sadness, worthless, lack of interest, you don't want to get involved in things, you just withdrawn. So depression is a mood disorder. And you're feeling down, you don't want to, you just, sometimes you might have suicidal thoughts, you just want to end your life because you feel everything is not working or you're worthless and all that. So although sometimes grieving, some people mistake grieving to depression. Grieving can, maybe you lost a loved ones or something, you're grieving, but grieving usually is for a short term. So when it becomes depressive is because it's now a longer lasting mood. You're always sad, you're always, worthless, feeling worthless and all that. So basically depression is a mood disorder.
Okay, thank you. So, you said it's a mood disorder, but we know that I think depression comes in different forms, in different ways. Would you, can you highlight some of the forms in which depression comes? What are, there will be some different forms of depression. Would you be able to highlight some for us, some of the forms of depression?
Okay, yes. Depression comes in different form. Like I said, there's clinical depression, that's major depression. That one is long term. That one is the one that, okay, people, you already know, oh, this person is constantly sad, constantly feeling sad. That is long term. So there are other forms of depression like persistent depression. This comes and goes. Sometimes maybe it might have to do with probably activities around you. For some time you feel sad, then after a time you feel okay, and it comes and go. Then there are some other depressions that are peculiar to women. You can call that perinatal depression. Those have to do with, especially women who are like childbirth age, when you're doing, especially during pregnancy periods and after pregnancy, they call it postpartum depression. You feel down, you feel depressed and all that. So there's another type of depression. Then we have a bipolar depression. Those ones are, you constantly feel bad, you constantly feel sad. So these are some levels of depression. And before you can be diagnosed into each level of depression, it has to do with the duration. Like I said, the difference between each forms of depression is the duration. If it's constant or if it comes and go, or you that is just you're always sad. For the major depression that is clinically diagnosed, clinical depression, that is constantly feeling sad. You just have few moments of joy, few moments of happiness, but every other time you're sad. So that is the major form of depression, yeah.
Yeah, yeah. So I guess that major form of depression at that stage, it's really, really gotten to its peak, and more work will be needed for that. But as we go on, we'll discuss more into that. What would be some of the red flags that should be looked out for a patient or someone suffering from depression? So yeah, we are talking about the symptoms. I know you've mentioned you feel sad on and off, but are there other major or underlying symptoms that would occur? So for instance, a patient comes to you or someone concerned, I am concerned about the way I've been having this mood swings, and I come to you to yeah, that I want to, I come with some complaints. What are some of the symptoms that you would get from me or ask of me to know that, okay, this is the form of depression you're suffering from, or this form of depression?
Okay, thank you very much. Yeah, there are some symptoms of red flag, and you can call it, okay, so it's divided into various parts. One, physical, those are the things you can see, like angry outbursts, weight loss, feeling withdrawn, difficulty sleeping. Those are the physical symptoms you could see. Then you feel, okay, this person is depressed or going through depression. Those are physical. You see them. Weight gain, weight loss, withdrawn from close friends and family, angry outbursts. You know, you're no longer interested in the things you used to do. You're no longer participating in your work and all that. Those are physical things you see. Then the psychological aspect, things we don't really see, is difficulty sleeping, or you're oversleeping. You're adding too much weight, you're losing interest in a lot of things, you're not enjoying things you used to enjoy before. Low motivation, that's the motivation to keep going is no more there. You just feel down, you don't want to participate in anything. Lost in sexual appeal, probably if you're married or you're of a sexual age, you no longer have interest. Your husband or your partner can get concerned in all that. So those are the psychological aspects people won't really see. You feel suicidal, you feel just sad. So those are basically some of the symptoms of depression.
Okay, okay, all right, thank you. So I want to just create a scenario now. As I said earlier, we've talked about the symptoms, and I come to you as a patient, and in terms of diagnosis, what I come to you sharing my current state with you, what are some of the questions, investigative questions, would you ask? What are some of the questions that you ask me in the process of your diagnosis to get your final diagnosis, your final results on if to know if I'm really suffering from depression? What are some of the questions, and how would you go about the investigation? You can just I'm just creating a scenario here, so you can take me as your patient, and you are my advisor, mental health advisor.
I get you. Okay, if someone comes to me and asks or tells me about the way they feel and all that, first you want to ask the person, are you having difficulty sleeping at night? How do you feel? Are you always angry? Do you always feel sad? How do you react to things? Because again, there are a lot of things that could cause depression. Are you in a toxic relationship? Those are things you really need to know before you can now say, okay, things going on right now. Depending on the person's answer, you'll be able to deduce, okay, maybe this person is going through some form of depression. There are various forms of depression. So especially, I'll give an example, maybe a woman who just gave birth, if not properly managed, she could fall into depression. That's a postpartum depression. So if that kind of a lady comes to you and tells you what they're going through, you could ask, okay, people around you, what's really happening? Is anybody helping you with the baby, your partner, or anybody? At least she needs her brain to be relaxed. She needs to come off it. Oh, that's why, I don't know, like in Africa, when a woman gives birth, there are probably a lot of people around to assist. Those kind of activities helps in reducing depression in women. Maybe the mother-in-law, sister, brother, they're always there to help, because those activities can help curb depression if a woman is going through postpartum depression. So if a lady comes to you and is telling you, you need to ask, you listen carefully. Don't just conclude, okay, you're going through depression, because most times they don't want to just have that feeling. So you ask, you ask, how is their day-to-day activity? How are they feeling? How is their mood? Do they feel sad? Do they feel happy? How is everybody treating them? Are you, your self-esteem, are you okay? Do you carry yourself well? Those are the things you need to find out before you be able to say, okay, this person might be going through depression. You need to make sure that, yes, you've been able to capture their basic lifestyle, their day-to-day activities, social lifestyle, your friends, family. How do you talk to them? Are you withdrawn from them? Do you have interest in things you used to do? Are you cold? Those are basically, because if somebody gets withdrawn from all those activities, possibly they are going through depression.
Sure, 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 sure. All right, thank you so far. We'll go for a quick break, and when we return, we'll continue. We'll specialize now with the women in depression. And you spoke twice about postpartum depression. We want to know some triggers of postpartum depression after the break. Do stay tuned. This has been Ladies Digest. In case you just joined us, you can follow us on our social media handles on Facebook and YouTube at the Association of African Universities. And you can follow Ladies Digest on Instagram at Ladies Digest. Do stay tuned. All right, welcome back to Ladies Digest, and this is still Ladies Digest, and we are still discussing depression in the 21st century woman. And as I said earlier on, you can join us, you can follow us on our social media handles at Ladies Digest, Facebook and YouTube at the Association of African Universities. Yeah, Joan, are you still there? Oh, okay. So initially, I just wanted us to do like a general introduction of depression before we go more into the women aspect. And I'll read the statistics from the U.S. Department of Health, which says that women are almost twice as likely as men to have symptoms of depression. Some studies also show that 1/3 of women will experience a major depressive episode in their lifetime. So with this statistics, it shows that women are more likely to be depressive. I would want to know why. Why are women more likely to be depressive? And you mentioned twice postpartum depression. Maybe we'll take that as a case study or as a reason. And also, what are some of the contributing factors of women being depressive?
Okay, thank you very much. Yes, of a true, women are more likely to be depressed because of various factors. Yeah. You know, I talked about the prenatal depression that has to do with pregnancy and after pregnancy and all that. Even a premenstrual depression that has to do with, you know, all these women stuff. Then again, violence is more against women. You understand? Sexual abuse, violence, and all that. A lot of things happen against women. And you could agree with me that most of all these things, the after effect, it leads to depression. Because what is depression? When you're always feeling sad, you know, when you're always in a violent situation, yeah, it triggers depression. So if you look at it very well, you see that, especially, I don't know, most part of the world, like in Africa and in Asia, where women are not really, I don't know if you understand what I'm trying to say.
I get you, yeah. Depression is really not taken as a serious issue.
Yes.
Yeah.
So those things trigger depression in women. Violence, sexual abuse, lack of education, poverty, and all that. It could lead to low self-esteem. It could lead to angry outbursts. It could lead to a lot of things in women. So you could see where the statistics is really coming from. Because if, for example, women are doing better or are giving same privileges that men are given, it will reduce a lot of depression in women. But because some part of the world don't really make women feel recognized and all that, so all those things leads to depression in women. Apart from the postpartum depression, which possibly affects other women, there are a lot of things: hormonal development, hormonal changes. Some medications too can lead to depression. And some medication, I mean, like birth pills, birth control pills, and
Okay, yeah.
all that medication, yeah, they could trigger depression. Like thyroid problems, menopause, other conditions. You could see all these conditions are targeted at women. So these are some of the things that make the women cases in depression very high.
Yeah,
I
yeah,
don't know
yeah.
if you understand where I'm coming from.
Yeah. Yeah, so the postpartum depression, can you speak a bit more on that? What does it entail, and why are women, because I've heard about it so much on women having this postpartum depression. I remember I was watching a movie, a lady she gave birth, she had given birth, and she just left that, she wrote a note and left it for the husband and said she just wants to disappear. She left without, but it seems she had tried to hold on, she had struggled to hold on, but it seems she couldn't again. And she just left the baby and went to stay, lodge in some hotel. They had to go look for her and all that. And I was like, okay, this is an example of postpartum depression. So what are the reasons, the real main reasons for this postpartum depression?
Okay, postpartum depression, like we all know depression, what it entails. So when you're talking about postpartum, it has to be during pregnancy or after, maybe like few months, let's say 1 year after pregnancy. Those periods is very critical in a woman's life. During pregnancy, a woman needs all the support she can get, because you know, pregnant and working, pregnant, you're doing business, pregnant, if you're not strong enough, you feel sad. You feel you feel angry, especially if you don't have support, probably people assisting you or government. You don't have money, you've not even planned for the baby, what the baby is going to eat when it's born, what the baby is going to wear. All those things, it makes women go into depression. Like I said, it's very common in Asia, Africa, where government don't really support women. If you're pregnant, you have to think of what your child is going to eat, what your child is going to wear. All those things could make you feel sad, and you could fall into depression when there's no one to help you. So that is it. And again, postpartum, after the birth, nobody to help you, nobody to assist you, no therapy. These are some of the things that could elevate one's mood. So women going through all this depression again, like I always say, it depends on your environment, people there, is anybody helping you and all that.
Yeah, yeah. So I would also want to add that I think the lack of, should I say, mental awareness or preparation too, because I remember my sister told me, I think her second child, and she was like, when you were pregnant, they don't tell you many things that you should expect when you give birth, like the crying of the baby at night and other expectancies and other in quotes, I won't disturbance that you are not used to. So these are things that I think when during prenatal sessions and all, they don't put you through, your doctor doesn't put you through these things. So coming to meet them will be kind of a shock, and your body, your brain might not be able to stand it immediately. And I think that can be a contributing factor of depression. I
Yeah,
don't
yeah,
know
you're,
if,
you're, you're right. You're right.
yeah.
You're right there, because antenatal or prenatal classes classes, therapy classes for pregnant women. Even after birth, they still go back there. So there are some therapies they get, like yoga classes. All these things is to ease the stress of childbearing and raising children. So if more awareness are put in place, it's going to really reduce the risk of depression in women during childbirth and after childbirth.
Yeah, okay. All right, so let's move to seeking help. So I have the symptoms you highlighted initially. Mood swings, sadness, disinterest in many activities, unlike before. Let's say just started some 2 months back, and I feel this is not me. Maybe my spouse is even suffering, my family members are suffering, but I can't speak to them. I don't know how I will go about it. How can I seek help? What would be your advice on seeking help for a depressed woman who doesn't know she's depressed yet? She just feels some symptoms.
Okay, thank you very much. Talking about seeking help is the first step to seeking help is usually most people might not want to seek help because they feel they are fine, but first step is getting to trust somebody they could talk to, you know, because of the stigma involved with some of all these mental health states. A lot of people don't want to talk about it. So the first step is you prepare yourself, you get somebody, at least somebody you could trust, somebody you're able to talk to, somebody that can understand you. And again, family members, if they see somebody is no longer doing what they love to do, somebody is withdrawn, somebody is, acting in a way that is unusual, they should be able to meet the person, talk to the person. At first, I understand they will not want to talk about it, but again, it depends on your approach. Sometimes you can just, they call it, I don't know what to use. You could just, like, you, like a surprise. You don't want them to know. Maybe you want them to go see a psychologist or a therapist. You could just take them there and, like a surprise. You could just say, can you accompany me to somewhere? We need to see somebody, you know. But you have to be careful not to trigger their angry outbursts. You need to do it in a way. And before you be able to do it, you must have gained their trust. Show them you care. Let them feel heard. It's not like a power tussle. You must go here. I must take you to this. I must take you to the doctor. No, come down to their level. Oh, I understand what you're going through. I understand. You know, understand their level. Then when they have trusted you to a very high level, then they will come down. They will be able to explain to you, okay, this is how I feel. This is what I'm feeling and all that. So that is how it's not a power tussle. You don't have to drag them. Oh, you must go. You must go see a doctor. I don't like your mood. No, no, no. They're not gonna take it easy. Just take it easy. Listen to them. Take your time. Let them trust you, because it's not easy telling somebody the way you feel, and probably the person will not flare up at the end of the day. So that is how to get them to seek help. You need to come down to a level where they trust you, listen to them, and again, don't power tussle with them. It's not be like, okay, it's going to be a must. I need to take you there. No, you understand what
Yeah.
I'm trying to verify.
Yeah, and I think also acceptance too is needed. You suffering from I suffering from the depression, I have to accept that I need help first. And I like the trust aspect you brought in. But then I think also you should, in that, why gaining the person's trust, you should be able to know the person, because some people, if you, as you gave an example of a surprise visit, like let's go see a psychologist or something, like maybe surprise, but I think maybe you need to know the person first, because someone might not take that as a surprise or may not take it lightly, may really, as you said, flare up. So you need to know the person properly before you decide to give maybe that surprise visit or so. And that, I think, as acceptance is is the basic. Like, I should accept that I need help first before my partner or my spouse even gives the help.
Sorry to cut you short,
Yeah.
because most of them will not actually accept that they need help. A lot of people, they don't accept. So it's we, the loved ones, probably the spouse, the children, the family member, that really, like I said, most of them won't want to turn out to seek help. But you have to, like I said, gradually, and you find a way suitable. Like I said, what works for this person might not work for this person. It depends on the individuals involved, the family system, and the family pattern. So you have to study it very well and know what is good, how you will to manage that scenario.
Yeah. So for just a quick question is, can depression be treated? Are there treatments for depression?
Yes, depression can be treated
Okay.
in various ways. Like, sorry, you could use therapy, you could use medication, and you could use self-help. Self-help, like change of lifestyle, and some, change of lifestyle could help. So what I'm trying to say here is that when you use therapy, sometimes a combination of the three treatment plan could work. Sometimes one, maybe medication like antidepressant and all that. But before it could be treated, one, they have to know the cause of the depression. They have to know if it's caused by maybe an underlying illness or something. They have to really know the cause of the depression. The cause of the depression will determine the type of treatment the person will be placed on. And again, the severity of the depression, is it severe, is it mild, all those attributes contribute to knowing the kind of treatment a person should go for. So when you check an underlying depression and there is no medical condition associated with it, you can use you can use therapy, you can use self-care, which is like change of lifestyle. Change of lifestyle, probably there are things you used to do that triggers the depression. You have to reduce them or stop doing them. So you could use this, include exercise. Maybe if you're putting on too much weight and it's making you feel depressed, by the time you change your eating habit and all that, you could feel better. So regular exercise, these are lifestyle treatment. Regular exercise, your nutrition, your sleep. If you're not getting enough sleep, they will tell you all these things. And like I said, it's dependent on the type of depression you're going through. If it's clinical depression, that is the major one. Those ones, it could be a combination of the three: therapy, medication, and lifestyle. But if it's just normal, depression that you can snap in and snap out,
Okay.
probably therapy, yeah,
Yeah.
therapy is enough.
Okay, so let's take a scenario here where a married lady comes to you, that she's with concerns of depression, and she confides in you. What are some of the options you would throw to her? Options of treatment or options of managing? What are some of the options you would throw to her? Fine, you've mentioned therapy and all. What are some of the options you would throw to her in order for a loved one to know what she's going through? So yeah, we are talking about maybe she knows what she's going through. But there are some cases where you're trying to explain to your loved one, your partner, your mother, your brother, they may not understand. They may think you're just trying to seek attention. You are just trying to be an attention seeker. So what are some of the options you would throw to her whereby she can communicate a situation to loved ones?
Okay,
Yeah.
You're feeling depressed. Probably, there are some things that could trigger depression, traumatic and stressful events. You have to look at that relationship. How is it? Is it toxic? Is it trauma? Is it trauma bound? Those are the things you need to really check to be able to, because a lot of people in toxic relationship, they are depressed, but they don't want to leave the relationship. So you need to be very, very critical. You ask, how is the relationship? How is it affecting? How is your relationship with your husband? How is your relationship with your family? You ask her, because one of the things therapy does, that therapy enlightens you. It's not a medication or something. They talk to you, they enlighten you about depression, how traumatic events could lead to depression. Traumatic events could be toxic relationship. So you need to ask your relationship, how is it going? Is there any problem? Are you having any issue or any problem with the relationship? So if she doesn't want to open up, at least if you're a psychologist, you could read her mood. Like someone in a toxic relationship, most times they don't really want to talk about it. But if you observe their mood, you begin to deduce, okay, something is really happening.
Well, yeah.
So from there, yeah.
Okay, so
So
what
from
if,
there, you need to go.
sorry, to
Go
cut you,
ahead.
what if it's not a toxic relationship, and maybe I'm with my parents or with my husband and we are living well, but I'm still depressed? So I'm asking how how you would advise me to communicate my situation, my depressed situation, to my loved ones, so they understand and they can help me or understand if I'm behaving, having this mood swings and all. So yeah, I'm talking about
Okay.
communicating my situation to my loved one.
To your family.
Yes, yeah. So what are the options you would throw to me?
Okay, I'm
Yeah,
getting now.
yeah.
To communicate that situation to your loved ones, that means I need to be speaking to them. You need to be speaking, I need to speak to them to tell them that, see, there are times they just say, okay, if someone is going through depression or going through a mood swing, you should let them be. Let them be, in the sense, don't flare up. And the people there, they need to take care of themselves, because it could be very frustrating and exhausting dealing with people with mood swing. You can snap out of any move within a twinkle of an eye. Those people around them need to be mentally fit. You need to be okay. They need to understand what that person is going through, so that if by any chance their mood swings or they snap into the angry mood, they are aware. Okay, they are aware. Okay, see, anything is going can happen. So they need to know how to deal with conditions like that. Most time why people have problem with living with somebody that is suffering from depression, because they are not aware, they are not informed what to expect and how to handle it. They are not aware, and they just feel, oh, this person is not behaving okay. They are not informed. But with the right awareness, if they are informed, of course, if someone is depressed, your GP or your doctor can talk to the family member, can teach them how to manage that person. When the person is angry, what to do, when the person is feeling down, what to do. But most importantly, don't always leave them alone, because sometimes they could have suicidal thoughts. When you see them withdrawn completely, don't just leave them alone. You need to go, just make sure they are not always alone, because if they are alone, they could harm themselves. So communicating with the family is the doctor or the psychologist have to be communicating with the family, has to teach them how to manage someone like that, has to teach them, like I said before, when they don't want to seek help or when they seek help, you need to build the trust, which is the number one thing. They feel safe to tell you what they are going through. It's not just about being a family, maybe a brother or sister. Sometimes they might not trust you. You need to build that bond. You need to make them trust you. You need to make them feel heard. Let them say what they want to say. Don't rant. Listen. There's no harm in listening. Just listen to them. When they feel that, okay, you always listen to them, even if what they're saying doesn't make sense, it doesn't matter. Listen to them. When they feel that, oh, this person always listens to me, with time, they will be able to start confiding in you.
Yeah, thank you very much, Joan. We've run out of time, and I really appreciate your time. And I hope when next we call on you, you would honor our invitation.
Okay.
Yeah. Are you on social media? Would you want to share your social media handle? Because I know you have you give a lot of tips on your Instagram handle, on your Instagram page. Would you like to share your Instagram page so people can check and get more tips on your on healthy living?
Yeah, okay. My Instagram, where I talk about promoting when mental and emotional well-being, is Drone Speaks Life.
Okay. All right. All right. Nice having you. Thank you for spending some time with us.
Yeah.
All right. Bye. Yeah, this has been Ladies Digest. In case you just joined, you can always catch us up on our Facebook and YouTube handles at Association of African Universities, and follow us on our Instagram page at Ladies Digest. And we discussed depression. And one thing you should know, that depression is common and it's treatable, so you should seek help. Don't stay in and say that, oh, I'm depressed. You should seek help once you notice any little change in your regular self. I'm Joan Ekuya. You are. Till I come your way next time, do stay tuned. Bye.